Hi, my name is Francia Carolina de los Rosas, and in today's segment, we're going to be talking about sexually transmitted diseases. Even though we're not talking about all of them, we're concentrating on one, that is HIV or AIDS. We have five guests that are going to talk about this topic with us. That is Dr. Dante Benito Ramirez, Dr. Alessandra Quesneda Segura, Dr. Meniz Merari Cabas Alvarado, and we also have medical researcher Tigbarway de los Santos, and finally, we have a patient that is going through this disease, that is Ángela Samantha Carranza Esquivel. My first question is for a medical researcher. Tigiba, can you tell us a little bit about the origin of this disease?
HIV is an infectious tumor came from a type of chimpanzee in South Africa. The chimpanzee version of the video called Human Immunodeficiency species of HIV. Studies show that HIV may have been transmitted to humans when the hunted chimpanzee from the meat and came into contact with the infected group. As earlier Easter lay an 1800, the virus slowly spread to Africa over several decades and endangered other parts of the world.
That was very interesting. Now, Dr. Meniz, can you tell us what is this disease and what does it consist of?
Hello, I'm Dr. Meniz Merari Alvarado, and I'm here to answer the question, what is HIV/AIDS? HIV, also known as human immunodeficiency virus, is a virus that attacks the body's immune system. If HIV is not treated, it can lead to AIDS, which is known as an acquired immunodeficiency syndrome. HIV weakens a person's immune system by destroying important cells that fight against disease and infection, specifically the white blood cells CD4, leaving the individual vulnerable to diseases such as tuberculosis. AIDS is a late stage of HIV infection that occurs when the body's immune system is badly damaged by the virus. It's chronic and potentially life-threatening.
And Dante, can you tell us how is this disease transmitted?
Most people who get HIV get it through anal or vaginal sex, or by sharing needles, syringes, or other drug injection equipment. Also, HIV can be passed from mother to baby during pregnancy, childbirth, or breastfeeding. So, these are some of the most common factors of getting HIV.
Okay, so you're saying that this disease is not only transmitted by sexual activity. That is also very interesting. Now, Dr. Alessandra, can you tell us how can we prevent this disease to spread?
I'm going to explain you the preventions for the HIV infection and if there is a cure or if there is not a cure. There is not an effective cure for this infection, but if you have a proper medical care, you can live with the infection under control. Now, how can a person reduce the risks of the infection, like of contracting the HIV infection? Get tested of HIV. You need to go and check yourself. Use condoms with the person that you are going to have sex. Limit the number of sexual partners you have. Get tested and treat for sexually transmitted diseases. And it is so important for you to go and check yourself, even if you don't think that your couple or the person who are you having sex is not infected, because you never know.
And finally, Angela, can you tell us how this disease has changed your life, of course, regarding to your health and also the symptoms that you've experienced with this disease?
Hi, I am Angela, the patient with AIDS, also known as HIV, and I am going to tell my symptoms, which they are like weight loss, and this weight loss got like menstrual symptoms like colics, but also kind of tissues. And the decreasing health, like in the future, is that my immune system wouldn't fight with the virus or infections that comes up with my body. So that is a reason that most of the people say that the HIV is like dangerous because it can kill you. And also, when you have babies, well, they will have HIV too. So that it's very important that we check what is happening in our daily day.
With this, our segment has come to an end. We hope that this information was really helpful for you and that you could understand a little bit more what is this disease about. Thank you so much to our guests, and we will see you next time.